Semen analysis for medical laboratory scientists and technologists. Collection and transport of specimens for semen analysis. 1. It is extremely important for patients to be given detailed instructions for semen sample collection. 2. Deviation from instructions can result in less desirable samples and laboratory testing limitations. 3. A single semen sample is generally not a reliable measure of semen quality. For samples taken over a period of several months will give the best baseline results for each individual. 5. Similar abstinence periods should be used for each collection. 6. Specimens can be collected in a private room near the laboratory or collected at home. 7. In either case, the patient should receive both verbal and written instructions that are easily understood. 1. Samples must be collected with a minimum of 2 days sexual abstinence, but no more than 7 days. 2. The entire ejaculate must be collected. 3. The sample should be collected in a clean, wide-mouthed glass or plastic container that has been confirmed to be non-toxic to sperm. For sample temperature should be maintained between 20 to 37 degrees Celsius. Large temperature fluctuations prior to testing may alter some test results. 1. Avoid the use of condoms and lubricants, which can be spermicidal. If the patient is unable to collect a specimen through masturbation, a specialized medically approved non-toxic condom may be used. 2. Specimens not collected on site must be delivered to the laboratory within 1 hour of collection. Sperm motility will decrease if there is a delay in transport. 3. Sterile collection for microbial analysis. 4. Patient should urinate prior to semen specimen collection. 5. Patient must thoroughly wash, using soap, rinse, and dry hands and penis. 6. Patient must use the provided sterile container to collect the ejaculate. Details of specimen collections are essential in order to ensure the viability of the specimen. This is especially important when the collection is obtained at home. The following should be recorded and reported. 1. Method of collection recommended, masturbation, or non-recommended, any method other than masturbation. 2. Type of specimen container, glass, plastic, or medically approved condom. 3. Period of abstinence. For date, time, and location, at home or a site outside the laboratory, of collection. 5. Time the sample was received in the laboratory. 6. Completeness of sample, e.g., collection difficulties, incomplete samples. 7. Transport problems if collected at home, temperature variations. 8. Patient's complete name and date of birth on the specimen container. Quiz. Failure to include the first part of the ejaculate in specimen collection can result in which of the following? Please select the single best answer. 1. Sperm count is decreased. 2. pH is falsely decreased. 3. Semen volume is decreased. 4. Specimen will liquefy at a faster rate. The answer. The first part of the ejaculate is rich in spermatozoa. Upon missing collection of that first portion of ejaculate, the sperm count will be decreased. A falsely decreased pH is wrong, the pH could be falsely increased. The semen volume will not be affected as the second part of ejaculate primarily contributes to the overall semen volume. The specimen will liquefy at a faster rate is incorrect. It will not liquefy. A patient delivered a semen sample to the laboratory. The medical laboratory technician immediately rejected the sample. Which sample collection scenario would prompt this rejection? Please select the single best answer. 1. Sample was provided in an over-the-counter condom. 2. Sample was provided in glass container. 3. Sample was provided in plastic container. 4. Sample was kept at room temperature and delivered 30 minutes after collection. The answer. Specimens collected in over-the-counter condoms are rejected due to the spermicide found in the condom. Spermicides will falsely decrease the sperm count. A medically approved condom can be used if needed but must be provided by the physician or laboratory. Both plastic and glass containers that have a wide mouth opening are acceptable for collection. Samples should be kept between 20 to 37 degrees Celsius and delivered to the lab within 1 hour of collection. Semen viscosity and liquefaction. Normal liquefaction. Semen is a viscous fluid that immediately coagulates after ejaculation. Post-ejaculation semen samples will begin to liquefy in a few minutes, with most samples liquefying within 15 to 30 minutes. The sample becomes thinner and more liquid rather than a coagulated mass, but it still is more viscous than water. Often the sample will have liquefied by the time it is delivered to the laboratory. Samples may take up to 60 minutes to completely liquefy. However, if liquefaction has not occurred by 30 minutes, it should be noted. Samples that do not liquefy within 60 minutes have abnormal liquefaction. It is critical that samples reach the testing bench within the 60-minute time frame so an accurate assessment can be made. Gentle mixing during liquefaction at room temperature or at 37 oC will aid in producing a more homogeneous sample for testing. Delayed liquefaction. Samples that do not liquefy within 60 minutes should be recorded as having abnormal liquefaction, as the accuracy of some results will be affected. Problem specimens that do not liquefy can be treated to aid in laboratory testing. Any treatment of specimens must be recorded as any addition of enzymatic or physiological agents may affect semen biochemistry, sperm concentration, sperm motility, and morphology. Liquefaction and homogenizing of samples that do not normally liquefy may be accomplished using one of the following methods. 1. Mechanical mixing. Repeated gentle passage through an 18/19 gauge blunt needle attached to a syringe. However, this is not always recommended, as the shearing forces can damage sperm. 2. Addition of equal volumes of a physiological medium, example, saline, and repeated pipetting of the sample, though this could change motility and concentration. 3. Enzymatic digestion by bromelain or chymotrypsin, which are proteolytic enzymes. This can also change motility and concentration. Semen samples should never be vortexed to aid in liquefaction. Vortexing will damage the sperm. Semen viscosity. High semen viscosity can adversely affect the evaluation of sperm motility and concentration. Semen viscosity may be tested by aspirating a portion of the sample into a pipette and allowing the semen to drop from the pipette tip. Normal viscosity will result in discrete droplets from the pipette. If viscosity is abnormal, varying thread lengths will be noted. Any length greater than 2 cm is considered abnormal. Grading systems may be assigned, and systems may vary. Some laboratories may use a number system, such as 0, watery, to 4, gel consistency. Other laboratories may designate the viscosity as low, normal, or high. The methods used in delayed liquefaction can also be used to decrease the viscosity of the sample. Both abnormal, delayed liquefaction and increased viscosity have an impact on both fertility and semen testing in the laboratory. The motility of the sperm is limited when viscosity is increased, or the sample does not liquefy. Laboratory testing may be negatively impacted by the difficulty in attaining a homogeneous sample for accurate counts and observations. Semen color, appearance, pH, and volume. Physical examination should take place immediately after liquefaction but no longer than 1 hour after collection. Volume. The preferred method for measuring volume is collecting the sample in a pre-weighed container. After collection, the specimen and container are weighed, and the container weight is subtracted. The volume is then calculated by using the weight of semen, assuming a weight of 1 g/ml. This method is not always practical for some routine laboratories. If the container used to collect the sample has volume indicators of at least 0.1 milliliters, the volume can be determined directly from the container. If the sample must be transferred to a container with graduated volume indicators for measurement, the sample should be transferred as carefully and thoroughly as possible. Pouring sample from the collection container into a graduated cylinder is not recommended as the specimen can be lost in transfer. Appearance, color, pH. The pH of the semen specimen reflects the contributions of the various gland secretions in the production of seminal fluid. Normal semen is slightly alkaline. pH should be measured after liquefaction at a uniform time, but at a minimum within 1 hour. pH values can be obtained using pH paper with a range of 6.0 to 10.0. A pH meter may be used, but is not required. Alkaline reflects seminal vesicle secretions. Acid reflects prostatic secretions. An abnormally high ratio of prostatic fluid to seminal fluid will produce a more acidic pH. Note that reference ranges cannot be used as distinct limits between fertile and subfertile men, as many variables exist. Volume. Normal 1.5 to 5.0 milliliters. Abnormal less than 1.5 milliliters. Abnormal indications. 1. Incomplete collection/ejaculatory. 2. Duct obstruction. 3. Poorly developed accessory glands. Appearance. Normal opaque/opalescent. Abnormal turbid. Abnormal indications. 1. Infection. Color. Normal gray-white. Abnormal yellow, red, or red-brown. Abnormal indications. 1. Urine contamination, certain vitamins or drugs, or jaundice, yellow. 2. Presence of blood, red or red-brown. pH. Normal greater than 7.2. Abnormal less than 7.2. Abnormal indications. 1. Increased prostatic fluid. 2. If low volume and low sperm count are also noted, may indicate ejaculatory duct obstruction or congenital bilateral absence of the vas deferens and poorly developed seminal vesicles. Quiz. Lisa is a newly graduated medical laboratory scientist who has just completed her training/orientation at a medical center laboratory. While on her shift, a semen sample was received for analysis. Upon verification of patient information, collection, and test ordered, she begins the physical examination of the sample. The sample has the following characteristics: volume of 2.0 milliliters, gray color, opalescent appearance, and pH of 7.5. Which of the following statements is true about this specimen? Please select the single best answer. 1. Sample volume was decreased, patient may not have a complete collection or there may be an obstruction. 2. Sample pH was decreased, patient may have increased amount of prostatic fluid in sample. 3. Color/appearance was abnormal, patient may have an infection. For all physical characteristics were found to be normal and within range. The answer. This sample was found to be normal with all physical characteristics in range. The normal sample volume should be between 1.5 to 5.0 milliliters. A sample pH should be at least 7.2 or higher. Samples should be gray-white with an opaque or opalescent appearance. A sample received in the laboratory is not liquefying properly after 60 minutes of sitting at room temperature. The medical laboratory scientist will need to assist the sample in order for it to be ready to be analyzed. Which method is not a correct process for assisting liquefaction? Please select the single best answer. 1. Mechanical mixing by using a syringe/needle to pass sample repeatedly at a slow rate. 2. Vortexing for a minimum of 20 seconds, assess, and then repeat again as needed. 3. Adding an equal volume of saline and pipetting sample repeatedly to mix. 4. Adding proteolytic enzymes for enzymatic digestion to initiate liquefaction. The answer. Semen samples should never be vortexed as this can cause damage to the sperm. Acceptable methods to assist liquefaction include mechanical mixing by passing the sample through needle/syringe gently and repeatedly. Adding physiological mediums like saline at an equal volume and then mixing by pipetting the sample repeatedly. Adding proteolytic enzymes such as bromelain or chymotrypsin to begin enzymatic digestion.